Our top story now, at least 11 patients in intensive care have died at Tirupati's Ruia Hospital yesterday evening following the disruption of oxygen supply there. Videos have emerged that show a mad scramble inside the wards as medical, paramedic and others are trying to revive and keep patients alive in the crisis.
ఎంత తీవ్రంగా ఉందో చూడండి సార్. సార్ ఇది సార్ పై వార్డ్ సార్.
All right, let's go across to NDTV's Uma Sudhir for more. And Uma, it's just heart-rending to see the kind of panic inside the ward and relatives wailing. Give us more details of what happened. An inquiry too has been ordered.
Yes, indeed. The Chief Minister has ordered an inquiry. This incident happened at around 8:30 yesterday in the evening at the SVR Ruia Hospital, the biggest government hospital, in fact, in Tirupati, which has a bed capacity right now of more than 1,100 patients. What we understand is that there are nearly 400 oxygen patients and about 150 ICU patients in this place. And there is a 10,000-liter oxygen tanker there. But that had almost got empty. And those people who were on ICU and who were on ventilator were being shifted to bulk cylinders. And during the process of shifting them, we are being told that the pressure had in fact fallen. While the patients are saying that they did not have oxygen supply for at least 25 minutes, some of them saying as many as 45 minutes. The rest of the people, in fact, the authorities, in fact, saying that the disruption was only for about 5 minutes. The district collector, Mr. Hari Narayan, has confirmed that there were indeed 11 deaths yesterday because of the disruption in the oxygen supply. Those videos that we have got from inside the wards of the hospital certainly very, very heartrending as the patients, attenders are desperately trying to revive them. Some of them, the paramedical staff and the doctors also trying to use CPR on many people. You can see some people are already lying unconscious with no state, so there is no way of knowing whether they have in fact passed away as well. So the district collector said that the oxygen tanker that was to come from Sri Perumbudur in Tamil Nadu had got delayed. The shift would happen to the bulk cylinders. The oxygen supply was in fact present, but there was some problem because of which there is a pressure fall, and that's what had led to the kind of crisis that we saw in the ICU wards. He said that in fact a major disaster had been averted because of the quick thinking on the part of the doctors and the paramedical staff. But we do know that the doctors and the nurses got very, very tense as the patients attenders in their anxiety and in their panic. In fact, some of them even ransacked the ICU and threw and broke some of the equipment there. And the medical staff, in fact, got worried that they would be attacked. We were told that some of them had gone and hidden themselves inside the bathroom. Some of them tried to move away from the hospital. But subsequently, of course, everyone, as we can see in the visuals, there are medical staff also present there. And about 30 doctors were working even after the so-called crisis was over and trying to revive the patients. So what kind of an effect it has had on other patients who also suffered dip in oxygen, that as of now is not yet clear. What we are expecting is that in a short while from now, the Chief Minister may get a detailed report of what really happened in the hospital, what led to this crisis, whether it's a technical problem or really a shortage of oxygen, which of course the collector has denied, saying that there were bulk cylinders available and there was, yes, a delay in the tanker coming in from Sri Perumbudur. Back to you, Gargi.
Right, Uma, it just gives you a sense of, how it's such a race against time, especially in view of this oxygen issue and oxygen supply issue. As you're telling us, the central supply of oxygen in this particular hospital ran out and they had to shift these patients onto oxygen cylinders during that time. At the same time, you're saying that, oxygen trucks, tankers that were coming from Tamil Nadu had got delayed. And just even if it was, 5 minutes as the administration says or 45 minutes as the patients say, it cost 11 lives. So it just goes to show how critical things are getting inside the hospitals, isn't it?
Absolutely, because there are over 35,000 patients, in fact, in beds, corona patients who also require oxygen. And that was one of the things that was brought to the attention of the Chief Minister, saying that the health infrastructure is not able to cope any longer. And even though governments of Telangana, Andhra Pradesh have been reluctant to bring in lockdown, a partial lockdown was brought in Andhra Pradesh, precisely citing this reason about increasing number of patients, all of them requiring oxygen, and increasing number of the levels to which the hospitals and the medical staff in Andhra Pradesh themselves have been stretched. So there is a partial lockdown between 12 noon and 6 a.m. every day. Between 6 a.m. and 12 noon, there is some relaxation when the essential services can happen. The second aspect of this, Gargi, is that we are talking about, they were already using about 480 metric tons, and they were expecting that would go up to 1,200 metric tons the demand for oxygen in Andhra Pradesh. Of course, there is a Vizag steel plant, but the lower parts of the state, whether it's the Rayalaseema region, they would have to be supplied by Ballari and also by Tamil Nadu, Sriperumbudur, and with every state, in fact, now feeling that pressure on the supply of oxygen, it is becoming an issue between states as well about whether the oxygen would reach on time and adequate supplies would reach. The second aspect also that I want to point out is that several of the patients in Andhra Pradesh try to come towards Hyderabad, that is seen as a major medical center in the two Telugu states, and near the borders of Andhra and Telangana. In fact, all the ambulances were stopped by the Telangana police yesterday because of two reasons. One, even though there is no official, kind of a clampdown on the movement of vehicles between these two states, even then the Telangana police stopped them, saying that unless you have a reservation in the hospitals, we cannot allow the ambulances to pass through, and therefore there were queues of vehicles that were standing, and it was a very, very distressful kind of a situation. Some people pointing out that Hyderabad technically is the capital of the divided state of Andhra Pradesh as well till 2024, and therefore this kind of a stoppage in the movement is not fair. But Telangana on its part feeling that there is a pressure on the beds and allowing more and more of these patients to come into Hyderabad and creating more of a pressure on the health infrastructure in Telangana and in Hyderabad may not be a very viable solution.